With more cases locally, more people are going to the hospital. Action News reporter Bob Brooks is live at Temple University Hospital tonight. Bob, you've been talking to medical people. What are they telling you?
Well, Jim, they have optimism around this second wave of COVID. They know more about this virus. They know how to treat it better, and that really begins with early intervention. Hernan Alvarado is the director of respiratory care at Temple University Hospital. He treats COVID patients every day. And for the second wave, he says they've learned so much. Maybe most importantly, it's getting oxygen to patients early who can barely breathe.
We've had success with high flow nasal cannulas, which is an oxygen system in which you're giving someone a faster, higher liter flow. With a higher amount of oxygen concentration.
And sometimes it's given to patients even before they arrive here.
Instead of waiting for them to get to the ICU setting, for example, or to get to a floor, that started actually in the emergency room now.
He also says new drugs approved by the FDA, like remdesivir, are helping too. And because of that,
our ICU numbers are fine at this point. Have the numbers increased? Of course they have.
In fact, Pennsylvania COVID hospitalizations have hit a new milestone. More patients are now admitted than ever before, with 2,900 across the state. And over in Montgomery County, Lankenau Medical Center staff says the same here, as well as every hospital within the mainline health system.
We've seen slow, steady increases over the last couple of weeks.
But Dr. William Sorkis says this second wave is a little different.
Things we were seeing more in the spring than we're seeing now is injury to people's kidneys, where their kidneys were unable to function, to do their job.
And just like the first wave of COVID, ventilators are still needed, as are their ICU capabilities.
It's still a very unpredictable virus, which is why the best case of COVID is not to get COVID.
Now, Jim, both men say the typical COVID patient is someone who is older, but it can impact anyone, especially those with underlying conditions. That's why they're urging that demographic of people to use extra caution as we go through this second wave. From reporting live in North Philadelphia, Bob Brooks, Channel 6, Action News, Jim.